access to information and experts to help you improve your health. LifeBeat, a radio magazine, brought to you by One Joshua Group, building capacity, expanding resources.
According to the U.S. Department of Housing and Urban Development, in its 2018 Homeless Assessment Report to Congress, an alarming number of people are identified as experiencing homelessness. However, counts have generally trended downward over the last decade, and this downward trend can be attributed to the focused efforts and resources from service providers, local leaders, and federal partners that have made it a priority to end homelessness. Hello, I'm Kermit Payne, and welcome to LifeBeat, a radio magazine produced by One Joshua Group. This segment focuses on the National Center for Medical Education Research and Development at Meharry Medical College and its third annual conference on communities of practice. The center contributes to strengthening the capacity of medical schools to promote meaningful curriculum transformation by engaging experts and stakeholders in the areas of persons experiencing homelessness, LGBTQ, and migrant farm workers. We caught up with a few experts and stakeholders during the conference, and the interviews that follow provide a perspective of some of the participants in this unique gathering. Bobby Watts is the Chief Executive Officer for the National Healthcare for the Homeless Council in Nashville, Tennessee, and the council supports the 300 federally funded healthcare for the homeless programs and also medical respite providers with training, technical assistance, sharing of best practices, research, publications, and an active policy and advocacy program working to eliminate homelessness. Here's Mr. Watts' perspective on policy and persons who are experiencing homelessness. Persons experiencing homelessness. Do we know who those people are when we see them, or are we just bound to the stereotypes that we think people are who may be homeless?
Yeah. Well, certainly there's some people, when we look at them based on where they are living, we see them sleeping on the streets or the sidewalk, and we can be fairly sure that they are truly experiencing homelessness. But oftentimes there are many people who don't have a stable place to live that are, it's not obvious to them. It's not obvious to the general public. Studies have shown that about 1/4 of people, of single adults experiencing homelessness, work regularly, and they get up, they find a way to get clean, and they go to work, they come back, sometimes in their encampment, sometimes in a shelter, sometimes in a car. And looking at them, you would not know that they are a person experiencing homelessness.
Do you think these population numbers are greater than we believe?
Most experts believe that the number from the point in time count, which is the single most definitive count, because it's done all over the country on a given night, generally in the month of January or February. That number is used a lot, and it's just over 500,000 individuals in the last point in time count. However, that is for one night. It overcounts it counts very well people who are in shelters, but it undercounts those who are out on the streets or in the woods or in encampments. But even if it was a complete count for one night, we know that in the course of a year, it would be at least 2 to 3 times that number.
Part of, I think, how we can address some of this address this issue is around the policy implications. Here in the state of Tennessee, how has the legislature impacted the change in the experience of homelessness?
Well, I think we have to realize, and what the National Healthcare for the Homeless Council does, it works at the nexus of healthcare and homelessness. And we have to realize that healthcare is a major reason why many people experience homelessness to begin with. Personal bankruptcy due to medical costs is the #1 cause of bankruptcy in this country. It's been that way for decades, with a few years during the financial crisis of 2008, 2009, around that area. So here in Tennessee, The government has decided not to expand Medicaid as most other states have. As a result, people are not getting the health care that they need. If they are, they're running up bills that they can't pay. We have rural hospitals closing, and therefore people aren't getting the mental health care that they need. They're not getting the substance abuse care that they need. They're not getting the medications that they need to stay healthy and keep working. And therefore, I think that is a factor that is causing some people to become homeless or making it much more difficult for them to escape homelessness here.
The advocacy and services required to support persons experiencing homelessness are numerous, and they vary according to the demographics of the locale, like the Downtown Women's Center in Los Angeles. Mr. Spencer Coates is the Director of Health at the center, and he shares examples on how the specific needs of women are addressed by the center.
So how we see the homeless population, at least in Los Angeles, 55 and older is a larger percent of it. And so if you imagine your mom being homeless or your grandma, that's kind of how I see it at this point. It's 55 and up is what we see the growing age of homelessness in Los Angeles.
So, I want to hear more about your podiatric services and how we get people to see and how those programs work.
So all of our health services, we try to be participant informed. And what that means is our participants come up to us because they are the experts of their lives in homelessness. And then we take what they want and try to give them those services. And one thing that constantly comes up is vision services. Vision is extraordinarily hard to get. Most of our clients are either uninsured or on medi-cal. Medi-cal does not cover glasses unless you're under 21 or in a nursing facility. So they'll give you the prescription, but they won't cover the cost. So when you think that homelessness is changing to women over 55 years old, we have individuals who are walking around without glasses. If you lost your glasses, if I took my contacts out, I could not function. I literally could not do anything. But now we are expecting these individuals on the streets to somehow get to case management appointments, take the bus. Taking the bus with glasses is hard, let alone without glasses. So what we do is we offer mobile clinics in partnership with the Tucci Eye Foundation to not just give them the eye exam, but give them the glasses on site free of charge. We do that multiple times a year. And that's the importance of listening to your community members, because if you didn't listen to that, you would not know that need was there. Another unique program we've started to offer is working with Cal State University Northridge, which is with their athletic training department. The way we kind of see our population is they are athletes. They're athletes in a non-traditional sense. Instead of doing the 400-meter dash or playing baseball, doing shot put, they are carrying 40-pound bags about 5 miles a day. They're standing on their feet. Who can stand on their feet the longest? Who can hold on to bags with the most forearm strength as long as they can all day? These participants literally are carrying everything they have throughout LA on buses, and then at night they have to sleep standing up or in very awkward traditions. So we've actually partnered with or working with athletic trainers who, although traditionally they've worked with athletes, they're adjusting their scope to work with our individuals, to work on their carpal tunnel that they've developed, their flat feet, their rheumatoid arthritis, all these issues that are specific to the homeless population that we would not know unless we talked to our participants and said, hey, I have a lot of arthritis. I have a lot of arthritis too, and you start to see that trend. And then you start to make partnerships that try to address that.
We close our segments asking our guests about their life lessons. Here are the thoughts they leave us with.
I think the lesson I learned the most is to be trauma informed. So when working with populations that have experienced such a huge amount of trauma, understand that, and understand that that trauma is going to impact them developmentally. It's going to impact their behavioral issues. It's going to impact a lot of things. So don't just judge this person and say, oh, how dare they do this? That doesn't make any sense. Think of it, look at that person's history and go, what happened? Well, all this trauma is probably impacting those behaviors, those life choices. So instead of looking at a negative point of view, look at it from a strength-based point of view and be like, they've experienced all that and they're still working towards meeting their goals and their needs. And how can we capitalize on that strength and move that person a little bit closer to getting housing? So always be trauma-informed.
I can't do any better than the words of Jesus Christ. and that is to love God with all your heart and to love your neighbor as yourself. If we really loved our neighbors as ourselves, then we would find a way to treat them fairly, regardless of their race, regardless of their ethnicity, regardless of their income, and we would find a way to make sure that their needs are met, just as we would for ourselves or for anyone else in our family.
As a nation, we must commit to addressing and resolving the experience of homelessness. Meharry Medical College and the National Center for Medical Education Development and Research leads the voice on this issue by providing curriculum and training for physicians and other healthcare providers. One Joshua Group is pleased to participate with this partnership as we continue to work with our clients to develop pragmatic, collaborative, and cost-effective policy and program solutions to build capacity and expand resources. I'm Kermit Payne. Thank you for joining us.
This edition of LifeBeat is sponsored by One Joshua Group, your strategic source of engagement to achieve health equity. For more information, visit us at theonejoshuagroup.com or follow our work on Facebook, Instagram, and Twitter using hashtag #OneJGCollabs. One Joshua Group, building capacity, expanding resources.